Order. I call Dr. Beccy Cooper to move the motion.
Thank you, Mr. Efford. It's a pleasure to serve under your chairship this morning, and alongside my parliamentary colleagues who have kindly come along this morning to have time to debate and to highlight the public health emergency that is obesity and fatty liver disease. For the vast majority of us, we don't often think about the health of our livers. Or if we do, our biggest concern is how many units of alcohol we're drinking every week and whether our livers can keep up. But we do talk about our weight a fair amount, either in terms of how we look and how our clothes fit, or if we are linking it to disease, whether we are blocking up our arteries and risking a heart attack. Today, I want to make the case for linking our concerns about being overweight and sedentary with the very real risk of developing fatty liver disease. And before I give the alarming statistics about the huge increase in liver disease in the UK, I want us all to hold on to the fact that a weight loss of 10% can halt and even reverse fatty liver disease progression. And that the way to help us all to do this is not to point fingers and to tell individuals to try harder. There are much more effective public health solutions than this. So, now for the alarming statistics that should give us all pause for thought. After heart disease, liver disease is the biggest cause of premature mortality and lost working years of life in the UK. And in stark contrast with other killer diseases where the mortality rate has gone down, deaths from liver disease have increased by 400%. Yes, that's 400% over the past 2 decades. So every year, we are now seeing 18,000 deaths from liver disease. It is now the biggest killer of 35 to 49-year-olds in the UK. And in 2 to 3 years, it is set to surpass heart disease as the leading cause of premature death in the UK. This debate today matters because fatty liver disease is becoming one of the defining public health challenges of our generation. A disease that already affects as many as 1 in 5 adults in the UK, equating to about 1 million people, but one that hardly anyone knows about. When I asked my parliamentary colleagues to come and speak in the debate today, they went, fatty liver disease? What's that? So hopefully this debate is really going to highlight this alarming disease. Closely linked to our ongoing struggles with obesity, fatty liver disease, and its clinical name, for the record, is metabolic dysfunction-associated steatotic liver disease. That's the last time I'm going to say that today. Fatty liver disease is deeply rooted in our broken food systems and in the stark health inequalities our communities face. Of course.
Thank the honourable member for giving way and congratulate her on securing the debate. She's outlining very clearly the importance of the issue. Would you agree with me that what she's outlining is essential and very vital that people are aware of? But an additional byproduct of that is that the NHS waiting lists over the coming years, if we don't deal with this issue, are going to be compounded even further than they are already.
I thank the honourable member for making that excellent point, and he is absolutely right. The issues of the NHS waiting lists are pertinent and stark, and reducing them will absolutely mean that we have to get the left shift right, as well as investing in the acute services. Thank you. So our policies have failed the population for decades, and this debate is an opportunity to make the urgent case for a national liver strategy, for joined-up public health work, and profound reform of the conditions that are stopping us all from living well. Because we have failed to build an environment where healthy food is affordable and accessible, 2/3 of UK adults are now overweight or obese, and 1 in 3 children in England are above a healthy weight when they leave primary school. Now, fatty liver disease is a silent killer, often asymptomatic until at a very advanced stage, meaning many patients are diagnosed too late for effective intervention. And left untreated, as too many are, fatty liver disease can progress to liver inflammation, fibrosis, cirrhosis, liver failure, or liver cancer. And fatty liver disease also significantly increases the risk of heart attacks, stroke, and heart failure. Within a decade, fatty liver disease is projected to overtake alcohol as the leading cause of liver transplants. So how do we treat it? Despite high and rising mortality rates, there are limited treatment options for patients with fatty liver disease. Weight loss and lifestyle change, as I've already said, are essential. We know... Oh, yes, of course.
I thank the honourable member for giving way and thank her so much for bringing this very important subject to Westminster Hall. She's absolutely right. Fatty liver disease is the fastest rising cause of liver cancer death in the UK and highlights the risk of developing a less survivable cancer for people living with obesity. Does she agree that improvements to diagnosis and treatment for fatty liver disease should be covered in the National Cancer Plan, which I called for a year ago, and the government is going to announce early next year?
I thank the honourable member for his excellent intervention, and I absolutely agree that the National Cancer Strategy is essential, and we must make sure that liver cancer is integrated into that, and diagnosis and treatments are a key part, and make sure that they are funded across the country to make sure those inequalities that I'm going to talk about are addressed sufficiently. Thank you. So, to go back, weight loss and lifestyle change are essential before we get to diagnosis and treatment. We know that a Mediterranean diet plus exercise improves liver function and that reducing ultra-processed foods reduces intrahepatic fat. But for those whose disease has progressed to scarring of the liver or liver fibrosis, there is an urgent need for therapies that directly target the liver. There are currently no drugs licensed to treat fatty liver disease in the UK. We have fallen behind the United States and Europe as our market is too small for prioritisation. If I might get a bit more political here, this is driven in part by our decision to leave the European single market. But this is a rapidly advancing field and we are approaching a potential breakthrough in treatment. With adequate planning, coordinated action, investment and leadership, we can ensure the system, our national health system, is patient-ready to deliver the next generation of medications and that all patients, regardless of postcode, can benefit. Early diagnosis offers significantly better outcomes and a wider range of treatment options. But, despite being medically recognised in the 1980s, clinical and public awareness of fatty liver disease remains far too low. We urgently need to increase public understanding and encourage early liver checks, particularly for those at higher risk due to obesity or type 2 diabetes. What is more, we have seen primary care systemic failures to improve early detection, so that 3/4 of people are diagnosed with cirrhosis at hospital in an emergency when it's too late for effective treatment or intervention. Well, of course.
And I also congratulate my honourable friend for an excellent debate, a really important debate. Can I take a back to what she was talking about in terms of food industry and wider population prevention measures as well? What this means, for example, around school meals, what it also means for our poorer communities who are reliant on food supporters as well, like Trussell Trust and others, in terms of the type of food that is made available to them.
I thank my honourable friend for that excellent intervention, and she is absolutely right. With her public health expertise, she is highlighting the very real problems that lead to fatty liver disease around our food system, our broken food system, the access to good nutritious food for children in school, and making sure that our stark inequalities, health inequalities, are addressed. I will come to that later in my speech. I thank her very much. So to go back to diagnosis and treatment, we should note that a staggering 80% of England currently has no effective detection and treatment pathway. Yes, a staggering 80%. The British Liver Trust here today is rightly calling for an end to this postcode lottery. So a key ask raised by this debate today is that every integrated care board, every regional national health area that we have, should have a full pathway for the early detection of liver disease. There is some excellent innovative work out there that can help us to get to a much better place in our tackling of this disease. I recently met the team at Predictive Health Intelligence, who I think are here today as well, who have developed Hepatocyte, which is a great name, well done, an inspiring example of how technology can transform early detection. Their system uses existing NHS data to identify people at risk of liver disease before symptoms develop, allowing GPs to proactively invite patients for screening and support. I am delighted to say that it is now being implemented across NHS South West and is proof that with genuine support from senior NHS management, clinical and digital teams at all levels can come together for the good of patients. This system is exactly the kind of innovation we need to make early diagnosis and prevention the norm and not the exception. So, to prevention. Screening and early diagnosis are, of course, vital. But as for all population health issues, as my honourable friend has rightly highlighted, we must have a laser focus on preventing the root causes of fatty liver disease.
On that point,
of course.
And I thank the honourable member for giving way and for raising this debate today. Of course, in this debate, we're calling obesity the enemy, but the liver doesn't really count in pounds and kilograms. The real culprit isn't body weight, it's metabolic dysfunction, as the honourable member points out, insulin resistance, poor diet, genetic risk, and so forth. And of course, lean people get fatty liver disease as well. It's not always people who are overweight. And I wonder if the honourable member would agree with me that we should maybe talk less about obesity and talk more about screening early, about taxing junk food, about treating metabolic disorders and disease rather than BMI strictly, because I think if we chase the scales, then we might miss the science.
I thank my honourable friend for that excellent point, and I think absolutely, I think in our society we focus on how people look for many reasons, cultural reasons, commercial reasons, and this is purely about health. This is about keeping people healthy on the inside and allowing people to live good quality lives, and he's absolutely right in that sense, so I thank him for that intervention. So to carry on and go to prevention and talk about poor diet, it is now the leading global risk factor for death and disability, and it's responsible for millions of preventable deaths each year. As I've said, in the UK, almost 2/3 of adults are overweight or living with obesity, increasing the risk of fatty liver disease, cardiovascular disease, and a multitude of cancers. In my job as a public health consultant, I see a lot of data and I read a lot of papers, but this particular statistic really did shock me. 4 in 10 children with obesity may already have fatty liver disease. 4 in 10 children living with obesity may already have fatty liver disease. This demonstrates the urgent need to act now to prevent an even greater epidemic of disease in the future. This hasn't happened by accident. It is the result of a broken food system, one that has made the UK Europe's 3rd most obese country and one of the world's biggest consumers of ultra-processed food. We have a system that makes the unhealthy choice the cheapest, easiest and most available choice. Healthier foods now costs more than twice as much per calorie as unhealthy food. So that's £10.24 per 1,000 kilocalories compared with £4.50. And for fruit and vegetables, the cost is even more at £11.90 per 1,000 kilocalories. For the lowest income households, following a recommended healthy diet would swallow half or more of their disposable income. So it is no surprise that obesity and fatty liver disease hit hardest in poorer communities. So, as I said at the beginning of this speech, this is not about personal failure. And as honourable members and honourable friends have said, I think that sometimes when we discuss this, people feel that it is individual failure, that they are failing to lose weight, they are failing to keep themselves healthy. This is not about personal failure. This is a political failure. It's our collective failure to create a food environment that protects rather than undermines public health. If we are serious about prevention, we must be serious about reform, the right type. with stronger fiscal and regulatory measures to reduce the availability and marketing of foods high in fat, salt and sugar, and to rebuild a food system that serves public health and not profit. So, why haven't we addressed this yet? Weighted against the commercial gain of the food and drink industry, our obesogenic environment is killing our population and costing the taxpayer billions. Economic analysis last year suggests excess weight costs the economy £126 billion a year. £126 billion. We've got a budget coming up next month. I'm fairly sure my Chancellor, our Chancellor, would like £126 billion a year. And that takes in wider factors such as lost productivity, care costs and lost years of healthy life. The direct NHS cost of obesity is projected to rise from £6.5 billion to £9.7 billion by 2050. We cannot separate our health and our wealth, nor can we hope to achieve economic growth without tackling issues such as obesity and fatty liver disease. Since 1990, there have been nearly 700 policies proposed by government to reduce obesity. Imagine having 700 policies about your life. 700. Past strategies fell short because they targeted behaviour change, individual choice, rather than the structural and commercial drivers of diet. Many lacked delivery plans, timelines or evaluation frameworks, leading to fragmented progress and limited long-term impact. So what can we do now to ensure that this public health emergency is addressed? My key asks for our Health Minister, kindly listening here today, are as follows. Firstly, there is a clear need for a national liver strategy ensuring increased public awareness, early liver checks and primary care pathways. As stated earlier, every integrated care board should have a pathway for the early detection of liver disease. Secondly, we need strong planning and coordination to be ready to deliver the next generation of medication for liver disease. And thirdly, if we truly mean to deliver the left shift promised in the 10-year plan to prevention, then we have to change the environment that is driving poor health. There is strong consensus on the necessity of upstream interventions to regulate the unhealthy food and drink environment. We can build on that strong consensus to extend the levy model to high sugar and high salt foods, enforce the 9 p.m. watershed for high fat, salt and sugar advertising, closing brands mark loopholes, provide stable funding for local food partnerships so councils can act on local needs, reinstate the full childhood obesity plan and address food affordability via fiscal reform. None of this is easy, otherwise it would have been done already. But right now, our environment is draining our health service of billions each year and weighing heavily on the nation's health, no pun intended. So let's not keep repeating our mistakes, but rather embed food policy as a national health priority, and through our work on preventing obesity and fatty liver disease, support and finally see the long-discussed and essential shift towards prevention and a healthier, wealthier country. Thank you.
Dr. Beccy Cooper, to wind up.
Thank you so much, Mr Efford. Thank you for chairing this morning. Thank you to the Minister for her excellent remarks. Thank you to all my parliamentary colleagues who have taken the time to be here for this debate. Thank you to the British Liver Disease Trust and everybody who's come to hear this debate. I hope that you found it edifying and useful. I have no particular further remarks. I think that most things have been covered. I think there is a lot of work to do, and I think just for us to remember that, as has been said, 90% of liver disease is preventable. 90%. That is a serious amount of disease that we don't actually need to face in this country, and that's an incredibly important thing for us to remember. in this environment, and my honourable friend has told me to say this slowly, in this obesogenic environment, which basically means it's hard for us to do healthy things and keep well. Our environment is encouraging us, consciously and subconsciously, to do things that aren't great for our bodies. So I refer to the remarks earlier where the opposition spokesperson said, we do have agency. Of course we have agency, but we are humans in an environment that is telling us all sorts of things all the time. Our job as parliamentarians, as representatives of our residents, as members of the party who is governing this country, is to make sure that the messages, the signals, the legislation, the environment that our residents live in is a healthy one. And within that healthy environment, people can then make their own choices. At the moment, I would say, for those people who accuse myself and other public health consultants of being a nanny state, frankly, the nanny we have in this state right now is not a great nanny. The nanny we have in this state at the moment is a nanny that allows us to eat things that make us ill, that encourages us not to exercise, and actually makes our children sick and means that we die earlier than we need to. So I do not want to live in a nanny state, but I do want to live in a healthy environment that allows our children to live well, that allows all of us to live the lives that we want to lead, that makes the healthy choice, the easy choice, the affordable choice, the normal choice, and that to do the things that make us ill, well, we've really got to try hard to do that. So thank you very much for your time today.